Hi, everyone, and welcome to the fourth episode of Animal News 101, Morris Animal Foundation's webinar series, Navigating the End of Your Life, Navigating the End of Life in Our Beloved Pets. My name is Sean Anderson-Vai, Public Relations Associate Director here at the Foundation. As you know, our goal with this series is to cover topics that are of interest to pet owners and animal lovers in general. We get a lot of questions about pet care and animal health here at the Foundation, and we want to share some of that knowledge with you. For those of you who are new to the Foundation, we are a global leader in supporting studies that benefit the health of animals, including cats, dogs, horses, and wildlife. With the help of our generous donors, we fund scientists around the world to do things like develop vaccines, diagnostics, and surgical techniques for serious health issues that animals face. We've been around since 1948, so 72 years now, and were founded by Dr. Mark Morris Sr., a veterinarian and pioneer in animal medicine who recognized a need for research that would improve animal health. Before we get to our presenters, I want to go over some housekeeping items. First, you should see buttons on the right side of your screen for questions, chat, and to raise your hand. If you have a question, please use the question button, but keep in mind we'll save all questions for the end of the webinar to keep things moving. Also, we can't answer specific veterinary questions about your pet. If you have any health concerns, please speak with your family veterinarian directly. We'll be monitoring questions behind the scenes, and if you have a technical question, we'll do our best to help you. We'll have a couple polls throughout this webinar, and in the interest of time, we'll give everyone about 15 seconds to answer before I close them. We'll also send out a survey about this webinar later, and we'll love it if you would fill it out. Tell us about what you liked and didn't like about it so we can better tailor future webinars to your needs. You can even help us choose future topics. Lastly, this webinar is being recorded, and we'll send out a link so you can watch it again or share it with others. Okay, now I'd like to introduce our President and CEO, Tiffany Grunert.
Thank you, Sean, and thank you all for joining us today. Pets bring such joy to our lives every day. It can be hard to think about the inevitable time when they'll no longer be with us. End-of-life issues are important to all pet owners, and there are resources out there to help make those decisions a little easier. Today, we want to share some of those resources with you and how to approach this difficult topic with support and education. Today, you'll hear from Dr. Kelly Knoll. She's a veterinarian with Caring Pathways, a Denver company which provides peaceful, compassionate, end-of-life care for pets with honesty, integrity, and respect in the comfort of their own home. Dr. Knoll helps families with the tough decisions about hospice and euthanasia by providing information, comfort, and support. I hope you all find this presentation informative, and thank you again for joining us. Sean, I'll send it back to you.
All right, thanks, Tiffany. Now let's introduce Dr. Kelly Knoll, our guest speaker today from Caring Pathways. Welcome, Dr. Knoll.
Hi. All right. Well, thank you for having me, and I'm really looking forward to interacting with you and answering your questions. I just wanted to share with you a little bit about Caring Pathways and how I got started. But first, maybe we should do the polls and launch a poll or two to get us started, shall we? I believe we're done with the polls. Shall I go on?
Yeah.
Okay. All right. So just to share with you a little bit about how Caring Pathways got started. And Sean, it keeps closing me out of my slides, and all I can see is my face.
Okay.
So there we go. It just keeps popping back to my full screen of me instead of the slides. Okay. Let's try this one. All right. A little bit about Caring Pathways. It really all started with this gentleman here. This is Dr. Larry Magnuson. I think he is a visionary, much like Mark Morris Sr. was. He has been a veterinarian for over 50 years in the Denver metro area. And he had actually built and ran 2 different hospitals and was a very successful veterinarian in his time. And he had retired, but then he was awoken by a dream at 3 o'clock in the morning, and he had this vision and this idea for serving people and their pets during end of life and for euthanasia, but in the comfort of their home. And his dream turned into a reality, and he started Caring Pathways. And he really was, he started by himself. He started out of his home, and with the help of his wife, Jackie, helping with phones and managing the practice. And he grew from one doctor practice to today, currently we have 19 doctors. And he just really wanted to grow this business of supporting people and their pets during end of life care, and being at home was a very important part of that. When he first started out, he was serving approximately 25 pet families a month, and we just celebrated our 10-year anniversary. And so 10 years later, Caring Pathway, we are serving approximately 600 pet families per month in the Denver metro area and Front Range. And just as that demand keeps growing and increasing, we grow and evolve to be able to support and provide compassionate care to families and their pets at life's end. My journey to Caring Pathways, I've been a veterinarian. I had been a veterinarian for about 13 years. I practiced in small animal medicine and surgery in the Denver area. And after 13 years, I took a break to be at home with my young growing family. And then when I was ready to return to veterinary medicine, I was really looking for something different. I didn't know what that was. I had looked in different areas of veterinary medicine, and I met Dr. Larry Magnuson, and after visiting with him for a very short period of time, I knew that this was what I wanted to do. And so I joined in 2014. So I just celebrated my 6 years with Caring Pathways. I was actually the 5th veterinarian he hired. And from there, I've just been doing this, and I just feel really proud to be a part of a team where we all work together and bring our gifts and strengths to really support the same purpose of providing peaceful and compassionate care for pets and the families in the comfort of their own home. So just to review, I just wanted to kind of let you know what the scope of our services is. We focus on end-of-life care, and we are a mobile practice. And the majority of our work is in-home pet euthanasia, and we also provide immediately following an appointment, we provide aftercare services, which most of the time involves cremation, and we offer a small collection of memorialization items, and we also offer grief support, and that's a really important part. We want people to feel supported and have somebody to turn to. We offer different literature, a book, and also we work with a grief specialist who's willing to be available to our clients. And she also has even started some Facebook groups privately, just so that pet owners who have lost a pet have a place to go where they're understood and supported through their journey. We also are continuing to grow our services and offering hospice and end-of-life care in the home. And what really this amounts to right now anyway is making sure a pet is comfortable. And it's about pain management, and it's about making sure they're eating and drinking, and that whatever care they need, their immediate needs are taken care of. And it allows us to improve the quality of life of a pet while they're still in the home, and not having to go to the veterinarian to do that. So we are able to assess quality of life in their home and support families in trying to keep their pets more comfortable for as long as we can until the decision is made for euthanasia. Okay, next slide.
Okay.
This was just, I wanted to just share briefly kind of the evolution of small animal euthanasia. It's changed quite a bit, even in my 20 years of practice. I mean, euthanasia has been a choice in veterinary medicine, so it's pretty commonplace. But I think standards and client expectations have evolved over time. We go back in time when owners may not have even been present for their pets' euthanasia, where they were given to the veterinarian's hospital, and the hospital would take care of it. And then maybe we moved forward and evolved into maybe one family member being present and staying with the pet in the vet hospital. And the procedure was done in an exam room on a table, and perhaps one person was there. And then kind of when I became a veterinarian back in the 90s, there was a evolution into getting off the table and getting on the floor and getting down with the pet on a quilt or a blanket, and having even more family present. Visits to pets' homes is not a new idea. It's just that it wasn't made widely available. It's very hard to leave busy private practice and to take that time, to set aside that time to support families. But it was done here and there. And then I think the next big evolution was the development of a comfort room. It's different than a traditional exam room, and it's just providing a designated space, more comfortable, more room for families. And I think that was a big improvement in standard of care for offering euthanasia in the hospital. And recently, within the last 15 years, there's been a creation of an International Veterinary Professional Association, so an actual professional organization that supports hospice and end-of-life care for pets. And we just see now practices are developing that their focus is also coming to the home for hospice and euthanasia. So it's really an emerging field that's continuing to grow over time. Next slide, please. This just kind of shows the progression of where we once started on the metal exam table to maybe being on the floor in the exam to a designated comfort room. And this is what I practice with my first 15 years in practice. But it's just not the same. Next slide, please. There's really nothing like the comfort of home, and that's just not something we can recreate in a hospital setting, no matter how nice we make the room. It's the familiarity, both for the family and the pet, that makes a really big difference. It gives them comfort when they're not feeling good. It gives them less stress, no need to travel, and those I think have a really big impact on those final moments with your pet. Next slide, please. It's just really about being there with your pet, being surrounded by family and those who love you in the comfort of your own home, so that you can create positive memories and have those meaningful final moments. Okay. I'd like to open it up for questions.
Okay, so one of the first questions we had was, how do I know when it's time?
Okay. I think that's the most commonly asked question that we get. And I think it's a really difficult decision. When I was a young veterinarian, and even in my training, we were taught to tell an owner that the owners will know when it's time. And I think that's true sometimes. I think there are signs in the pet, things that they're doing differently, things that they're not doing that they once did. But I also think that it's not always clear to an owner. And I think it's important for us to support owners and guiding them through evaluating the things that are important and the signs that will guide us to knowing when it's time. I think sometimes people think that, well, if my pet's still eating, then it's not time. And that's not always the case. Sometimes they've lost their mobility, or they're in so much pain that even if everything else is okay, their quality of life is so compromised that it's time. It's okay to intervene. I don't think euthanasia is designated as there's one day that's right and that before or after is too late. I think pets enter in sort of this window of time when at any point in that window, when an owner can kind of come alongside their pet in their condition, that it's okay. It's okay to intervene because it's kinder for them than it is. It's harder on us to make the decision when our pet is clearly suffering. It's easier to make the decision because there's really no other option. But I think it's okay to consider choosing euthanasia before that moment. And some of the tools that we use to help owners, certainly offering a consultation and visiting with a client and the pet in their home and evaluating the things that affect quality of life, things like their appetite, yes, their pain level, are they staying hydrated, how are they getting around, how are they interacting with the family, do they have more good days than bad days. There are quality of life scales that exist that can kind of help owners start to think about what they should be watching. And I just think our discussions and really getting to know the family and the pet help us support owners in making a decision when it's time.
Okay. Here's my question. I still feel guilt over euthanizing my pet. Is that normal?
Well, I'm not a grief expert, but what I can tell you is that I believe, guilt is a very normal part of this process because I think there's guilt on both sides. I think owners are so afraid that they're going to euthanize too soon, like they're giving up on their pet, but they don't want to go too late because then the pet might suffer. And I think what I usually tell owners is that guilt is very normal and it's just a reality of this process. But what I encourage people to do is to try to make the best decision with the knowledge that they have in that moment. And if your motivation for the decision to euthanize your pet is done in their best interest and it's on their behalf, you can't really make a wrong decision because it's about, it's not keeping them around for selfish reasons because you can't let go. It's making that decision to believe that they have endured enough and it's okay to free them of either current pain or even future pain or suffering. But I think guilt is really normal.
Okay. Another question. Do you know if pet insurance covers your services?
There are several different pet insurance companies, and it's I do not know what each company's policies provide, but what I can tell you is that I have had clients whose insurance did cover in-home pet euthanasia. So it just depends on what policy and what company you're working with, but I do know it exists.
Okay. Another one. How are you handling euthanasia during the pandemic?
It's been a challenge, just like everybody else trying to navigate. What we have currently done and what we're currently doing is we've moved appointments to being outside. So we're not entering people's homes at this time, but we are meeting them outside in their backyard or front porch or someplace where there's a space where the pets are safe. We're wearing masks and asking that the owners do the same, and we're practicing social distancing as much as possible. and our client relations team is doing some screening for us to make sure that people are healthy who are going to visit, and nobody in the home has been tested positive or is in any kind of quarantine. We're taking precautions in between each appointment site to make sure we're clean and that our tools and instruments and gear is clean, and but we're still serving, and it's I'm really glad to be able to do that. And even though the rules sometimes prevent being as close to your pet as you want to in this moment, I still think it's the best we can do given the circumstances that we're dealing with. Yeah.
Okay. Here's another one. My last pet died so quickly during the euthanasia process. Are there different euthanasia methods?
Yeah. You know, I hear that a lot too. People say, gosh, it happened so fast. When I was in private practice, the common practice was to use a one-shot approach. And that meant that your pet went in the back and got a catheter placed in their IV, in their vein, and then they came back into the room with you and they were given one shot, and they went from standing to passing very quickly. That's all I knew in private practice, because that's what we did. It was peaceful, but it was fast. When I started working for Caring Pathways, I learned a new approach that has since, over the years, been more adopted by many hospital practices who are doing the same thing, and that's a two-shot approach. Now, in the home, we do not place catheters, but I still believe that's standard of care in a hospital setting. They'll place an IV catheter to support the procedure. But our two-shot approach involves giving the pet two shots. And the first shot is given under the skin in their scruff, very similar to how they would receive a vaccine. And they're given medication that causes sedation and relaxation and complete pain relief over about 10 or 15 minutes. So once they have that on board, there's this time when they just kind of gradually melt into their bed or your lap, and you can just see that they relax and they feel better and they're not in pain, and you can be with them in that time. So that, I think that 10 or 15 minutes or whatever time it takes each individual pet, that's definitely a benefit, and I think an improvement over when the start to finish was so much quicker. The final shot is still very quick. When they're given the overdose of anesthesia in their vein as the last shot, they just fall asleep and drift off under anesthesia, just kind of like what we all wished for them, is could they just go to sleep and pass away, and that's what they do. And so they're completely unaware that they're passing away, and the passing can happen within a couple seconds or a couple of minutes. So every pet is individual and unique, and the timing varies between pets, but I think the two-shot approach is a really nice way, not only just for us, for the owner, but for the pet too.
Okay. Can you give us more details on what hospice care looks like?
Okay. I'm quickly sending a message to ask my daughter to stop playing piano. Can you all hear that piano in the background? I'm so sorry. Just trying to get that done before I continue. Okay. I'm sorry. Could you repeat the question for me?
Yes. Can you give us more details on what hospice care looks like?
Okay. So currently hospice care looks like it starts with, we have two different kinds. That's another thing that COVID kind of pushed us into, something we wanted to do anyway, but I think it got us on track sooner, is telehealth. So in the earlier days of COVID, we would actually have a virtual consultation between a pet and their owner and the doctor. And so that a lot of questions and discussion about how life has been for the pet, what conditions they've been struggling with, just a really thorough history of what's been happening and what are the owner's biggest concerns about wanting to try to improve. And it's also so that the can get eyes on a pet and really just see them at home, and how are they looking, how are they breathing, do they look comfortable, are they anxious, are they struggling to breathe, are they seeking affection and engaged with an owner, are they still responsive, are they still wagging their tail, or are they kind of in the corner or in the outside and they're not wanting to really engage with an owner. So telehealth was one way that we started that. And then traditionally, and what we continue to do is just now we are doing in-home consultations. We're just doing them in the backyard, and I've done several of those since COVID has happened. And it really is about, we're not there to make a diagnosis. We're not there to run any kind of lab work or do x-rays. We don't do any of that. We're there to focus on quality of life for that pet and understanding what diseases they may have, what terminal illnesses they may be struggling with, whether it's cancer or severe arthritis or mobility issues from something else, or kidney failure or liver failure, or maybe a neurological disorder, maybe seizures or something like that. When we can kind of understand what the pet's history is, we can also guide and support owners in making decisions about what's available for us to do to make the pet more comfortable at home, and what is that disease progression going to look like. So it's important that we take time to educate owners about, so my cat has kidney failure and she's doing okay now, but what is that going to look like, and how am I going to know as that changes? And that's topics that we spend time talking with owners about, is preparing them for the decline as best we can, and helping owners make decisions that are suitable for them, taking into account what an owner is realistically able to commit time-wise for a pet, to care for them. It's becoming a caretaker, and it's helping owners decide what's feasible and what's not, and then really we focus on quality of life. It all comes back to quality of life, and those are the questions that we continually ask and educate owners about, and helping them see that and monitor as that changes.
Okay. Another question, can you give us an idea of costs?
Sure. Our in-home euthanasia appointment currently during the daytime is $2.99, and that fee can vary slightly depending on if there's additional fees for weekend or evening. We also are traditionally we are a 24-hour practice, so we can schedule a euthanasia any time of the night too, when it's an emergency situation. COVID has affected that and limited our ability to do that, but we've just started doing that again. Fees for nighttime are much higher, similar to kind of emergency fees. But so that's our fee for an in-home consultation. For hospice care is the same, and we spend usually about an hour, sometimes longer, for consultations with an owner and their pet. We also make arrangements for body care and cremation, whether or not families want the ashes back. Cremation fees, I imagine, vary from place to place and even city to city. But the options that we offer our clients are to have ashes back or to not have ashes back. And getting on their weight and their size, it really is variable, but I can give you an idea that maybe a cat, if an owner doesn't want ashes back, then cremation is around $100. If they do want ashes back, it might be closer to $150. And then for a larger pet, say like a Labrador, not wanting ashes back might be maybe more like $120. And if they did want ashes back, it would be more like maybe $190. It's hard for me to answer that specifically, but that just kind of gives you an idea.
Okay.
I think.
Here's a tough question. What are problems you've seen and how can you avoid them?
Problems as far as, can you be more specific about what the problems during a euthanasia appointment, maybe?
I'm guessing that's the, yes.
Okay.
Or the process.
I'm sorry, say again, did you say the process?
The process, yeah.
Yeah, okay. I think some of the challenges that we all run into are sometimes the things that we can't predict because we don't know exactly what the state a pet is really in when we're there. Sometimes it's very planned and the owners have prepared and the dog is, shall we say, stable, versus coming to an appointment when the pet is already in crisis, where maybe they're in excruciating pain or maybe they're having trouble breathing. So I think the condition of the pet is one thing that can create problems. For instance, if a pet is having a hard time breathing, let's use a kitty for example. If they're having a hard time breathing, we worry about them stopping their breathing during the process before they've passed away. That can be a risk when they're heading into euthanasia with an underlying lung condition. Usually sedation and pain relief relaxes a pet. Most of the time that helps that, but sometimes, I need to prepare owners for that. Sometimes it's harder for a pet to breathe when they're sedated because of what's going on in their lungs. And in that case, instead of waiting a certain amount of time for them to get to their peaceful, happy place, when they're at a point of respiratory distress, that's the most important thing to relieve as fast as possible. And I always tell owners, and I explain this ahead of time, and tell them that there's always a plan B. And if your pet happens to have complications of breathing, that's the example we were using, if it gets harder for them, we just move forward with the final injection quicker. That's one example. Sometimes the condition of the pet will affect vein quality. I know that's one that is certainly upsetting to doctors as well as owners alike. And for instance, if a pet has hemangiosarcoma, which is a tumor in the spleen, sometimes they'll bleed into their abdomen, and that causes them to be really weak and collapse. Well, when an animal is bleeding in their abdomen and going into shock, their veins are very poor, and sometimes it's hard to deliver the medicine in the vein. And so there are alternative procedures we can do. What's another problem that we face? I think keeping everybody safe. Sometimes when an animal is in so much pain, I see a lot of pets that they've lost mobility, or mobility has become a really big challenge, and they're in so much pain that they don't want to be touched, not by their owner, not by me. And so that's a potential problem that we face in an appointment, just keeping everybody safe. And there are ways we can support that, and we use food, or we use distractions, or we just want to kind of sneak in that first shot, because then everything will be better for them after that.
Okay. I'm not quite sure about this question. What about pet siblings? I'm guessing, can pet siblings be in the room?
Yeah, that's a great question. Current thinking is that the most important part of a pet's sibling, so when a pet passes away, we believe it's most important that the other pets in the house are able to see and smell that pet once they're deceased. So when I go into appointments, other pets in the family are always welcome to be there. I think the best thing is to just kind of let the pets be where they want to be. I think in some certain cases, another pet sibling, maybe it's a younger pet and it's a bouncy puppy, or it's an animal that likes to take center stage and sort of demand all of the attention in the room, and they kind of sit on your lap and sit in the middle of things. And if it's something that's going to be distracting to the owners, I will often suggest, maybe we put the other dogs in a different room while we do the procedure, so you can have your attention and focus completely on the pet you're saying goodbye to. But it's so important that before I take the pet from the home, I want all the other pets to come and to see. And it's really interesting. Current research and thinking is that a sight or a smell of their deceased friend turns something in their brain to where they understand it's permanent. In the days when we didn't know these things and euthanasia was done in the hospital, you didn't bring the pack of animals to the appointment with you. And I think I hear stories all the time of owners saying, yeah, my other dog just looked for her for days and months and things like that. So I think it's one of the benefits of choosing an in-home euthanasia is that all of the other pets in the house have the benefit. So we make sure to give owners the option of that time. And interestingly enough, for instance, in dogs, most dogs and pets, quite honestly, they don't act like they care too much of what just happened. I think we as owners expect them to be very focused and very attentive and very sad when they see their friend. And that's not how most pets react or behave. It's more common for them to be kind of standoffish, maybe laying down and looking in another direction, or maybe they're glad they got let out of the room and they're excited to see you. They don't always engage. Usually it's a quick look and a smell, and they kind of move on to other things. It's rare for them to engage, but certainly I've seen it. I've seen pets groom or kiss or lick a deceased friend. I've seen cats curl up together. I've seen dogs vocalize. So certainly it can happen, but that's a more rare response. And the more common is that they're just, they kind of are creatures of the moment and they move on and don't really pay a whole lot of attention. But we still believe it's beneficial.
Okay. This is another tough one. Have you ever had a client that held on too long?
Well, I think it's a hard question to answer because it's, how do you define too long? I think that's such a subjective question, and people are different about how close to rock bottom they're willing to let a pet go before they intervene. And that's the part I can't control, but I certainly recognize. I think people figure out they wait too long after the pet is gone. And it's sort of a hindsight realization that, in the moment you're doing everything you can and you're trying to give them every possible chance, and you're trying and maybe it carries on longer, and you look back and you say, wow, we went too long. He endured too much. We could have let go earlier, but I just didn't know. yes, I think I've seen people hang on too long. It's far more common for me to see pets who are suffering, who have maybe hung on too long versus going prematurely. It's very rare that I meet someone and say, you know what, this is a premature decision. And I think most owners are worried about intervening too soon, when the reality is that's actually probably better for the pet. And I think it's hard. I think I see it most commonly with owners and their first pets. They just don't know. They've not been through it before. And maybe they look back and say, wow, we went too far, we went too long. Or maybe they went exactly as far as they want to. I don't know. But that wisdom that you gained from the first pet, I think, benefits all your future pets. Because I think, yes, I've seen it. I think it happens more often than we would like to see, but it's such a difficult thing to know. And I think it's not fair to judge that in hindsight, because that when you're in the situation making that decision, you just kind of take the information that you have in that moment. And something we always say, and I hear often, is it's better to go a month too soon than a day too late. And I think owners feel guilty about that and are hesitant to do that, but I think it's okay. You know, when they're declining, you don't have to wait till rock bottom to intervene. You can intervene here. They're not going to have to endure the bad that we suspect that will come, for us to say it's okay. I think at any point in that decline, when you know they're not going back up the hill, that it's going to be a decline, and there might be ups and downs and good days and bad days, but at any point along the curve, I think it's okay.
Okay. It's another interesting one. We have a question about getting permission from an owner. And have you ever had a dispute over euthanasia you got stuck in between owners?
So the first part was about getting permission.
Yes.
I haven't had, in 20 years of practice, I haven't really had much issue with that. There are consent forms that are signed. There's communication that happens. You must be 18 or older to give permission for a pet. So if parents are out of town and a 16-year-old is watching the pet, they can't give that permission. I think in the age of cell phones, it's easier to reach people who can give consent. So my experience has not been struggle with having accurate consent. I think the second part of that question is it about maybe when people in the family, could you say a part about the dispute? I'm just wondering if the household is divided on the decision, or maybe someone is for euthanasia and someone's not feeling like it's time. Is that?
Yeah, I think so, yes. Have you ever had a dispute over euthanasia that you got stuck in between two owners?
Okay, yeah. So that happens sometimes in hospice consultations when owners are not on the same page. And I think what I've learned over time is that you can't force anybody into the decision. And they may not like the decision once it's made, but forcing somebody into a decision that they're not ready to make is not helpful. I think it's usually then, if there's significant doubt on the part of a spouse or one of the owners, is that we take a step back and we don't make the decision that day. And I think owners have to respect each other. So then I kind of get stuck in sometimes in a position of, you need to support their decision that they're not ready, and you need to support their decision that they are. It's difficult, but I think through support and guidance, we kind of decide. We kind of help each other get there, or you give your spouse time, and you just give them space and support and different things for different people. But that doesn't happen really often, but it happens, of course, and we just try to navigate. And like I said, I think pushing it is one of the worst things you can do, because forcing somebody to do that is something that's I think, a really big regret. And you just kind of have to, it's a big enough and a permanent enough of a decision that you kind of have to find some common ground. And I also have heard people say, you know, I wasn't ready and my wife was, and I'm glad she was, because I would have never gotten there on my own. And it was her that gave me that push to kind of consent and agree with going forward. And in hindsight, I'm glad I did. So I think that happens just as much as really having a conflict.
Okay, this is a question for.
These are tough questions.
Well, this is actually a nice one about you and your coworkers. How do you and your coworkers self-care? This sounds like a really tough job.
Yeah. One of the things we do is we help each other and we watch each other very closely. We know that in this line of work that it can be very hard, and so we watch for signs. We lean on each other. We're honest about asking for help when we're feeling worn out, or and give each other support. And we also educate ourselves about things like compassion fatigue. And I think the profession of veterinary medicine as a whole is really focusing on quality of life, and veterinarians taking better care of themselves, and doing that, and taking time to practice things that help us recharge. And I think it's individual for each individual doctor, but it's certainly something that we have worked over time to create a culture that choosing to take care of yourself is supported, and setting limits and finding things to do that refills us, so that we can keep doing it. Because, you know, those of us who are doing it do it for a reason, and it's rewarding to help somebody have a beautiful goodbye with their pets. And that reward is helps make things endurable, I guess. And being a part of the gift that you are choosing to give your pet, you know, that feels really good. And we just have to watch each other and be careful, because you can, and not just veterinary medicine. There's a lot of lines of work where you can get stressed out and burnt out, and it happens, and I've seen it. And we're just being more proactive about being in a culture where that taking care of yourself is supported, because veterinary medicine has traditionally not always been that way.
Okay. How do I bury my pet?
So burial is certainly an option that some people choose. It's something that's regulated by the counties and the cities, so I can't keep track of the rules. In some places, it's illegal to bury your pet in your backyard. In other places, it's allowed. So that's something that the owner needs to research first. And then the AVMA, the American Veterinary Medical Association, has put out recommendations for burial. And it has to do with the depth of the grave. I believe it's 5.5 to 6 feet measured, and that you cover the grave site with a stone or a rock or something. And it's all designed to prevent any other animal from disturbing a shallow grave. There are some fines, actually, because when a pet is euthanized medically, their body is toxic to wildlife if they were to be exposed to that. And I think the government actually has fines about because of shallow graves and its effect on, at one time, the eagle population. So there's fines for that if you don't bury your pet, if they can trace that back to you. But there's actually pet cemeteries too. We have one not too far away up in Evergreen in the mountains. So that's an option too. There are some human places that are setting aside place in their cemetery or mortuary or ashuary is where a place where ashes go, where people can place their ashes of their pets. Maybe it's not burial of the actual pet, but ashes can be put in a permanent place. So there's a lot of details about burying pets, but I don't want to be too detailed if that wasn't the intent of the question.
Okay. Any advice on balancing medical intervention and hospice? Do you work with a practice when you're contacted about a pet?
Could you say that again? It glitched.
Yeah. Any advice on balancing medical intervention and hospice? Do you work with a practice when you're contacted about a pet?
So when we are contacted by an owner who's interested in engaging in hospice care, we will notify, with their permission, their regular veterinarian to work in conjunction with when it's beneficial. For instance, there are some medications that your vet hospital has that you can't get anywhere else. There are some medications that you can get from a human pharmacy, but that's limited. And so depending on what the care plan is for the pet, it's nice to have the partnership with your regular veterinarian, not only to keep them in the loop of what's going on, but for them to be able to dispense medications that we don't have access to. We don't have a pharmacy of any kind, so we rely on your veterinarian's pharmacy or a human pharmacy if it's appropriate. So yeah, so we do work with them. We don't have active discussions about plan. I think our focuses are kind of different, where our focus is really just quality of life and comfort care and supportive care, and certainly regular veterinarians are supportive of that, but we're kind of leading the discussion and the choices on that. Whereas if we feel like an owner isn't ready to euthanize and there are things that need to be done to help this pet in a better way, we talk about it. Maybe they're going to go back to their veterinarian for an x-ray, or maybe they're going to go back for a blood draw, or maybe they're going to go back and have their kitty's chest tapped because they are having trouble breathing, and taking the fluid off the chest is going to make that kitty feel a lot better. So yes, there is partnership and communication between us with regular veterinarians with an owner's consent.
Okay. Might have time for just a few more questions. What drug do you give in the first shot for euthanasia?
So for us, we use a combination of medications. We use a sedative, we use a narcotic for pain, we use a muscle relaxant, sometimes different pain control. So it's a cocktail of medications for that benefit for the pet, for cats and dogs.
Mm-hmm. Okay. And we're getting multiple questions from folks who are worried that they actually get their pet's ashes. Is this a problem that you see?
So I think the question is, and I hear this all the time, are you sure that when my pet gets cremated that I'm going to get my pet's ashes? Like, do I actually really get my pet back? I think
Yes.
that's the question and the concern. And I think prior to my time as a veterinarian, there was knowledge that there were crematories that were not being honest and ethical with the handling of pet ashes. And I'm saying like 30 plus years ago, perhaps. So I think that's where the doubt comes from. We work with a company that is very honest, transparent. They work with integrity and respect from the moment they receive the pet till the moment they hand the ashes to you. I am confident to every person that I work with that they get their pet's ashes. I've watched the crematory do their process so that I can tell an owner confidently that you get what you ask for. There are very ethical crematories, and I imagine there are some that aren't. And I think that you just have to find a veterinarian in a crematory that you trust, and that there are a lot of good ones who are doing very good work and allowing that to be an option. The crematories that we use, there's a system of identification where your pet gets a special tag. It's a stainless steel tag that has a unique number on it, and stainless steel survives cremation. So from the time it leaves the owner's house to when ashes are returned to owner, that pet has that tag with it. And so it can be identified by that tag at any point during the process. They very carefully collect and separate ashes. I think crematories have even gone to the extreme of wanting to have people's trust. Our crematory will actually allow you to witness cremation. Not every crematory will do that, and I think it speaks volumes about the one we use, is that they're willing to let owners come see what they do. It's because they don't have anything to hide and they're doing what they tell you they're doing. I think that speaks a lot about them. So I think these days it's much, much less of an issue than it used to be 30, 40 years ago.
Okay. We're getting some autopsy questions, or I guess in this case, necropsy questions. Can you get necropsies done, and how does it work in relation to the euthanasia process?
Mm-hmm. So in my world, there's two places a necropsy could happen. It's not something that our service provides. We would refer a pet back to their regular veterinarian. Regular veterinarian in practice can perform a necropsy. Some will gladly, others would rather refer it to somewhere else. And that second option is sending them to the state laboratory. When I was in practice in Denver, we would send, all of our necropsies to the CSU diagnostic lab. So there are places where they can go, and there's just some, we support clients in kind of the logistical of transporting, and in our luck, it's an hour away. Usually a pet's transported by car and taken either to the regular veterinarian or the state lab, and we can assist in transport, and sometimes we can if it's to the veterinarian or the owners transport their pet to an outside lab. So it is an option, and it's something that you can talk with your veterinary provider about. It's certainly something you kind of want to know beforehand. There's just things, if you're really trying to get an answer about cause of death, it's better to know that ahead of time and make plans and store the body properly so that the evidence is preserved, so that they can make the most accurate diagnosis. So it's hard for that to be an afterthought. So that's something I would bring up before the procedure of euthanasia so that you can get all those details ironed out ahead of time.
Okay. Well, I think that's all the questions we have. So I'll go ahead and conclude this by first thanking our guest today, Dr. Kelly Knoll from Caring Pathways. Thanks, Dr. Knoll, for being with us and sharing how we can provide peaceful and compassionate end-of-life care for our pets. And I want to thank all our viewers today. We hope you found this helpful and will make saying goodbye a little easier for your pets that you love so much. We'll send a link to this recorded webinar soon if you'd like to watch it again or share it with others. We also hope you'll join us next month when we talk about chronic kidney disease in cats. Until then, see you next time.